but you're driving by the flashing billboard of the hospital with the mission greeting you, "Be well." But you continue driving into the hospital and see an employee in their scrub smoking a cigarette. Or you walk into the healthcare facility and see someone sitting in a wheelchair, breathing with the assistance of a portable oxygen tank, suffering the effects of long-term tobacco use. Well, this is definitely a disconnect between the mission the hospital promotes and the image it gives to the community and the people in its care. But when an employer is selecting a new employee, or they should consider the health of the employee and the health of their company. According to the Center for Disease Control, 1 of every 5 deaths is related to smoking. In the U.S., with the increased cost in healthcare and the decreased productivity due to tobacco use, it's a staggering $193 million. I've taken several health classes and done research on the effects of tobacco use and have genuine concerns about the continued use of tobacco. Healthcare companies should not hire tobacco users for these following reasons. First, hiring tobacco-free employees. It will support a healthy image for the company that's main focus is health. Second, employ non-smokers. It can decrease the healthcare costs and increase productivity. Third, hiring practices that do not permit tobacco use provides an incentive for workers to stop this unhealthy habit. Last, despite arguments about discrimination, the practice of hiring people who use tobacco is not a protection of discrimination in all states. Well, let's get started with the thing that I think is the most important argument for why companies should not hire tobacco users. Well, this is the image of the company. But when healthcare facilities hire people who are tobacco-free, it will create a healthy image for the company and the mission they communicate to the public. Healthcare facilities and organizations that focus on a healthy living have mission statements that accompany their focus. The American Cancer Society's mission statement is saving lives by helping people stay well, get well, find cures, and fight back. Point of medical centers is be well. Eastern Idaho Regional Medical Center in Idaho Falls. But the mission is to improve lives of those we touch. Many healthcare facilities have recognized that not only they should publicize missions of the company, but the employees they hire or should support those missions and practice what they preach. The Massachusetts Hospital Association announced in November 2010 that they will no longer hire people who test positive for tobacco. According to the JunoEmpire.com website, on November 17, 2011, Providence, Alaska Medical Center and its affiliates around the state will join with other healthcare facilities to stop hiring smokers. When healthcare facilities develop a mission and present it to the public, or the employees they have need to follow this mission. When companies test new employees for tobacco use and only hire the ones who are tobacco free, or the health of the financial picture of the company will be increased. Or the benefits for a smoker is a lot more than the benefits for a non-smoker. Many American companies have noticed that the health cost for a smoker is more than for a non-smoker. But the average cost for health care for smoking is $10.28 per pack of cigarettes. But treating cancer that links smoking to its cause is $25,542 more than any other comparable tumors. But the lack of productivity is would increase the company's cost of employees. According to the Center for Disease Control, they report that a person that uses tobacco costs the company more than $3,300 in the healthcare costs and lost productivity. On average, a smoker takes more breaks than a non-smoker. They take about 4 breaks per day, and this would increase their productivity. A smoker has more diseases and illnesses than non-smokers due to the choice they made. And consequently, they take more sick leave days and die more prematurely than non-smokers. But then the companies have to use resources to retrain new employees for these positions. Or the more sick leave days they take, the less productive they are. The less productivity due to tobacco use is estimated to cost the company in the U.S. a surprisingly $97 billion. With increased image and productivity that comes with hiring tobacco-free users, but this will also benefit the employees for the future. With hiring tobacco, with places that permit tobacco use, this can have incentive for people to quit smoking. Ray Nicholas, president of the Massachusetts Hospital Association, believes in the all sticks, no carrot mantra. The raise in tobacco taxes is the carrot, and the decrease in places for smokers to smoke is the stick. And then with benefits for company and employees that is totally tobacco free, it's hard to see any opposition, but there are people that would debate this topic. Opponents of the ban on tobacco for employees state that it is discriminatory, but arguable can be. According to the American Lung Association, 21 states do not see smoking as a category of discrimination. World Health Organization has recognized that tobacco industry has spent tens of millions of dollars to support lobbying efforts that would benefit the tobacco industry. President of the National Work Right Institute, Louis Maltby, states that most people think they have the right to freedom of speech.